good morning, everyone. Given the fact that we have an external guest in our panel, I'm going to speak in English, so I hope that you don't mind. First of all, I would like to appreciate Ordem dos Médicos de Portugal, namely Dr. José Manuel Silva and Dr. Miguel Guimarães for the invitation. It's surely a pleasure to be here speaking in such a high-level panel about pre-graduate medical training and education. And it's for me a high responsibility as well, given that I am the official representative of all medical students in Portugal. Okay, so first of all, I'd like to start by sharing with you something that is very personal to me. I don't know if any of you had read this book. This book is named The Physician, and it was written by a medical journalist, Noah Gordon. He's Northern American. And this book takes place in the 11th century and speaks about and talks about a little boy, an orphan boy that was born in London and that travels in that time until Iran, most specifically Isfahan, the city where the first medical school was built, in order to be trained to become as a barber or a physician, because he started as being a barber, and in that time a barber are what we now call surgeons. And there is a key message that I think that it's essential for us to understand and to talk anytime that we speak about medical education, which is the fact that medicine is special. It is indeed very special because we not only take care of patients and their emotions, but sometimes we even get our hands inside of them. So I don't believe that there is any other profession that is so diverse and that implies so many diverse competencies. And just very, very quickly, medicine has evolved so much since we are known as a civilization. We as human beings, we know the text of Hippocrates, and we know, and here we have a picture of a barber, how barber it used to be, the way that they used to do surgeries in that time, and things have evolved. And by the moment that we started to discover the human body and we started wanting to study it and to open it, not being restrained by any kind of religious thoughts, we started to understand that maybe there are some dogmas that we should start questioning. And then the concept of medical teaching starts taking place, and this is a painting from Rembrandt, which represents a class of anatomy by Dr. Nicolai Stulp, and this represents a little bit the Illuminism that took place after the Renaissantism period. And now this is a picture of a simulation-based medical education in one medical school somewhere in the world that I don't know. But here this really looks like an emergency room, but it's a plastic body, so I don't think that it's actually a true patient. So things have evolved a lot. And more importantly, the reality that doctors need to tackle has evolved even more, and that is the challenge for medical education as well. So, yes, medical education is a science, and I will say something that might be a bit provocative, but a lot of people talk about medical education in a very amateur way, because I don't believe that a lot of people have read medical education papers or are actually following medical education journals. And yes, medical education is a science. And it's a science, I don't know if I've ever heard about this conference. AME stands for Association for Medical Education in Europe, and every year it organizes a conference, and I had the opportunity to attend the last one that happened in September in Glasgow. And more than 4,000 people from all over the world gather to discuss and to improve medical education. So, we are here to talk a little bit about pre-graduate medical education, not postgraduate, but maybe another provocative comment. One of the things that, from my perspective, is lacking a lot is talking more about medical education in postgraduate training, because people think that after medical students leave their medical schools, then they are up for the health system, and most of the times health practitioners or even health tutors don't try to update as much as they could by gathering medical education teaching skills and competencies. So this is a challenge as well for the ones that are delivering the postgraduate training in hospitals. So CanMeds is an initiative from the Canadian Royal College of Medical Doctors and Surgeons that aimed at discussing and coming to a consensus on what are the core competencies of a medical doctor, and thus what should be the given competencies for a medical student. And as you can see, there are several fields that a medical health expert must contain on him or herself. And we are not only talking about knowledge, scientific knowledge or clinical knowledge, we are talking about much more. And as you can see in this diagram, and this was highly discussed while it was being built, all of them comprise the same space in the diagram. So all of these fields are actually as important as the others. And this can be as well very discussable. But yeah, as you can see, a medical expert should be an health advocate, so someone who actually praises for good health and for the good status of health of the population. He should be a manager, okay, so managing my own service, managing in case I go for the head of the hospital, managing my own consultations, my own resources. A collaborator, because we will always work in a team, and as a team we must know how to collaborate. A communicator not only with the patients, but as well with our peers. We must know how to be able to communicate science in case we have to speak for the community. We have to act professionally, so trying not to be late. This might be a very complex thing in Portugal, I can understand. But still, there are many personal values that should comprise in the professionalism of a medical doctor. And finally, a scholar. So being engaged in academics, being engaged in research and medical teaching, either it is pre or postgraduate. So these are the 7 main fields that CanMeds had concluded that a medical doctor should comprise after his training or during his training. So after all of these debates, we can conclude that new educational paradigms must arise in order to tackle what we expect from a medical student to be in order to become a good or a great medical doctor, right? So we know in Portugal that medical schools are going through curricula revisions and developments, not all of them at the same pace, not all of them starting as soon as they should have, and this will be one of the things that will be pointed out next. So, ANEM, our national organization, we have a position paper that summarizes many of our stands on what we want for the future of medical education. And some of them will be screened here. But some of the things that I also screen here are some of my personal perspectives and some of my some of my personal beliefs for what should be medical education based on my experience. And I'd like to start with social accountability, and this is a striking feature for me for medical schools. Medical schools are responsible for putting out the medical doctors of the future, for the ones that will take care of the health of the population. And that is a huge social responsibility. So whenever someone leaves a medical school and is not ready to practice, there is social accountability in the medical school and in the system that could have allowed the exit of that medical student. But not only this negative social accountability takes place in a medical school, but as well making sure that medical students are leaders of their own practices, leaders in their community, so that they can achieve the 7 fields that the CanMeds had presented us before, so that they can have a positive impact on public health. And as well, medical schools should not be seen as limited and closed systems, but they should rather be seen as open institutions for the community, so that they can engage youngsters, school, toddlers, elderly, whoever wants to know more about health. So this is the first feature, social accountability. Then another thing that I believe that maybe 20 years ago was even unthoughtable was student-centered learning. We no longer believe that the classroom is centered in the teacher or in the tutor. The classroom has flipped, and now the main actor is the student. Because whenever the student is not the main actor, then we are not going towards what they need to know and how they should be presented the data. Because in medical education discussions, this is what is really striking, is how can data, how can information, how can knowledge be presented to medical students so that they can actually acquire the knowledge. I don't know if any of you, if we have a lot of teachers from many medical schools here, but for sure that you had students sleeping in your classes. And I don't think that's desirable, but I don't blame only the medical students, I'm sorry. I also blame teachers that do not have the capacity to engage students so that they are actually paying attention. So this is a shared responsibility, okay? So having feedback learning and teaching methodologies so that medical students can actually say, hey, I'm not enjoying this, so maybe it will be better to do this way. So this is why engaging medical students in the development of these skills of medical education is so essential. Student engagement, there it is. I'm a representative of medical students. I like that they actually organize projects, that they represent other medical students. I truly believe that this is one of the best ways to create future medical doctors who are leaders. And as you know, Portugal is needing true leaders, leaders with balls. And we are lacking that a lot, I'm sorry. So we need to, medical schools should be able to empower medical students. They should be the ones saying, go forward. You need to fight for your rights. You need to organize the projects that are about the things that you believe in so that they can be like this in the future. And this is an enabling power that medical schools not always had. But it is also important to frame this discussion in the nowadays constraints that are tackling medical education, and for example, the pressure that a lot of families actually have to put their children out of the university so that they can start to work is not enabling them to engage in extracurricular activities. Or the same way that taking into account the final classification of the medical course in order to access a medical specialty, I don't believe that will enable the participation of medical students in what they want. I believe that will make them being stuck in a room studying their whole course, and that is not what a medical student should be, and that is not what a medical doctor should be. Science, a lot of progress has been made as well in this field in Portugal, but a lot more should be done. Bologna process kind of helped with the masters, so more students are actually engaging in research projects, and that is really good. But it's not only enabling their participation for their masters, but giving them the chance to engage in research throughout their course, and also giving them research skills so that they know how can they outline a study. Either it is clinical or on public health or in basic sciences, or knowing for sure statistical competencies, how to use SPSS. I know that many of you had already struggled with this software. And talking about software, educational technology, we have seen in the last picture that I've shown you a human model that is made of plastic, but they can actually simulate true clinical situations, and that is one good example of how technology is helping medical education. As you know, we are currently facing limitations in what comes to pedagogic conditions. We don't have enough patients, thankfully, but we don't also have enough tutors for the amount of medical students that we have in the country. So we need to be creative and we need to think out of the box because the government doesn't do so. So yeah, this is why simulators are good. Digital 3D models, for example, some medical schools had already acquired a big anatomy table that is basically a huge touchable screen that students can use in order to explore the human anatomy. And this is good in cases where medical schools don't have corpses to allow students to see how the human anatomy is. Then this is as well a bit controversial, which is a competency-based approach to medical education, not only pre but also postgraduate. So CBME, competency-based medical education, is a totally different approach of how students should be evaluated and how they should be trained. So we must set, and CanMeds was really good to establish those competencies, we must set the core of competencies. And for example, in 2005, the medical schools in Portugal, at the time 7, they gathered their teachers' bodies in order to reach what is the core curricula of a medical student in Portugal. And there is a consensus document. Maybe it's getting time of revising.
2 minutes more?
Okay, yeah, I'm finishing. It's time to revise that document. But when we move on to the postgraduate training and we talk about giving specialties, not based on the time that a doctor had passed in the services, but actually if the tutor recognizes that the doctor has already the competencies enough to be a specialist, then we might be changing the whole paradigm that we are facing now. And in that case, we could have entrustable professional activities in which we create teams inside the hospital that is not based necessarily in if a doctor is already a specialist or not, but based on what are the competencies that a specific doctor has, and in that way we compose teams accordingly to different needs that the hospital might have. Then evaluation methods, they have been evolving, but since I'm running out of time, I'm not going to talk about it. Humanization is strikingly important. Yesterday we had a panel about that, so I don't think that I should insist on that more. Then interprofessionalism is something that is really important as well. Medical students cannot be stuck only with medical students. They must have contact and learn what it is to be a nurse, what it is to be a pharmacist, what it is to be a vet doctor, what it is to be a nutritionist, so that we can actually know how to direct public health situations, how to prescribe nutritional recommendations, etc. For example, in AMI, I met an architect who is a specialized architect in building interprofessional medical schools, so where medical students learn together with other professions. And just a provocative comment, a lot of international discussions are bringing to the field the skill mix discussion, so mixing the competencies between doctors, between nurses, and I think that this is a lot about this Congress as well, knowing how to establish boundaries in training and education, because that starts in medical school. Then, of course, curricular development. And finally, I'd just like to finish with the need that medical education being framed in the planning of human resources in a specific country. Recommendations from the GOA, the Global Health Workforce Alliance, which is an initiative of the World Health Organization, or even the Joint Action on Health Workforce Planning and Forecasting of the European Commission, they send recommendations that medical and other health professions training should be adapted to the reality and to the needs, so that we are not wasting resources. And this is what ANEM, my organization, has been working a lot these past years. We have finalized last year a study about the pedagogic conditions of the Portuguese medical schools, which was presented at AMI conference, by the way. And in this study, we conclude that the satisfaction of medical students with their medical training is negatively related to the number of medical students that medical schools have. And moreover, it's also about the ratio of medical students per tutor in the hospital that is determining this less satisfaction. And ANEM has been trying to point out to the government this, together with Medical Order and some other entities in Portugal, that with the current number of medical students that we have at the moment in Portugal, it is not possible to ensure the best medical education possible in the country, so that we can ensure Portuguese people the best health that they demand and that they deserve. So we have been doing some studying, some data gathering in order to tackle this problem as well. So
Alberto?
I'm not proceeding anymore. Thank you so much.